developed over the past decade because of companies like Apple and Samsung. Think about the consumer expectations we've developed because of companies like Amazon, Disney, and Netflix. More often than not, the experience you have in a hospital setting falls short of those expectations. There are many factors that will force the pace of innovation to accelerate, and many hospitals just aren't currently equipped to react and transform quick enough. Our speaker today is a Cumberland Valley High School graduate with an undergrad in cultural anthropology from the University of Pittsburgh and an MBA from Penn State University. Prior to starting Benjamin & Bond, he led the strategy and design firm Man Culture. He held various positions, including rising to become the CEO, and managed and led strategists, designers, and developers in developing research, design, and development projects for organizations in all sorts of industries. In 2015, he decided to take his skills in human-centered design and start a company focused specifically on healthcare. The past 3 years have mixed extremely meaningful consulting work with tremendous growth, allowing us to expand our business to start a venture fund that invests in health, IT, intellectual property out of universities and colleges such as Johns Hopkins, Carnegie Mellon, Pitt, and Penn State. Not only are we passionate about the work we're doing to further healthcare innovation, but we are so proud to say that we'll be doing it right here in York. Fellow Rotarians, please help me welcome our speaker today, the CEO of Benjamin & Bond, Mark Kandrysawtz.
All right, wow, thank you for having me. Can everybody hear me okay? All right, so I have to confess, when I had to prepare for this presentation, it was a little bit of a challenge for me because I'm really passionate about the work we do in healthcare. I find it incredibly intellectually stimulating and exciting for a lot of reasons that I'm going to share with you, but I realize for those of you in this room who aren't one of our healthcare partners from the community, you might not have the same perspective. So I challenged myself to put together a presentation that would allow me to advocate for the concepts that we thought were really important in a way that would be relevant for all of you, even if you're not in healthcare. So with that, I'm going to dive in. I'm going to move really quick so we can stay on schedule and allow a little bit of time for questions at the end. So to start, we always get this question, why did we name the company Benjamin & Bond? And we did because Benjamin Franklin, who's this kind of known inventor and innovator, and his friend Dr. Thomas Bond, who together in 1751 started the first hospital in the United States. It was actually in Philadelphia, and the building itself is on Penn's campus today, which is pretty cool. They did it because at the time, healthcare was delivered by physicians that rode on horseback to people's homes. And with the advent of the American city, and you saw big population centers growing, it was unsustainable for individual physicians to service all those people. So there was a great deal of physician burnout. The access to care was inadequate for all those people that lived in those communities. And so access was really poor and quality was poor. And we find it incredibly ironic that today we're working on some of the same problems that they sought to solve in 1751, like access and burnout and quality. But what we applaud is their willingness to buck the status quo, to not accept the way that things were done, and to do something bold to make big change in the country. So we consider ourselves to be torchbearers for that mission they started back in 1751. The other little piece of interesting trivia too is that when you're starting a business in today's age, no matter where you do it, whether in York or New York, naming a company is incredibly difficult because there's not a lot of websites left. So we were fortunate to be able to get benjaminbond.com, but it has a deeper meaning for us. Okay, so today I want to talk about the fact that healthcare is ripe for innovation. In fact, I'm going to take on a degree of advocacy for that point. I know that there's some people here that might kind of miss the old days of healthcare or lament the fact that the status quo is changing so rapidly before our eyes. But I want you all to walk away from this presentation believing that that degree of change is a really good thing, and those of you in the business community to look at that change as a great deal of opportunity to have impact in that particular industry. To do that, first I'm going to start by not talking about healthcare. So I think that there are some concepts that in general allow us to identify industries that are ripe for disruption and therefore ripe for innovation. Scholars debate, economic scholars debate all the time, all the different indicators that we should be looking for to identify those industries that are about to fall or about to be changed irrevocably. The ones that we care most about are consolidation of power, so the degree of M&A activity that's occurring in an industry, reducing competition and seeing bigger and bigger players. Antiquated technology. So the pace of technology change today is very rapid. Moore's law tells us that the pace of technology change and the cost of computing power goes goes down logarithmically year over year. And so the technology changes all around us, and is an industry adopting that degree of change fast enough to remain relevant? Next is poor customer experiences. So are you able to deliver a great experience for your customers, a purposeful experience for your customers? And last, increased regulation. So if an industry doesn't change for itself, the government will do it for you. So we're big proponents that in healthcare, part of the reason why we're seeing increased regulation is because of a lack of willingness to change. Okay, so I'm going to use a different example to get started, and we'll pick one that I think we can all agree is a pretty terrible experience, which is flying commercial airlines today. So if you look at the airline industry, I'm going to pick on Continental and United, so that merger is fairly recent in the industry. We see other consolidation happening. They're trying to gain efficiencies because of loss of market share or other variables that are impacting their bottom line. Integrated technology. So I just booked tickets for my wife to take a trip, and was trying to use points, and I had to book 2 different tickets so I could use points for one and cash for the other, and it was incredibly complicated, and the people on the phone couldn't even help me. And the bills and the itineraries that I got were very hard to understand. And I know that the industry's trying, so United just launched a new app. This is a screenshot of my actual app, to try and make it a little bit better. So I used it. I was flying recently, and I went to check in for my flight, which is really important because if you fly a lot and you have lots of points and you've got status, you want to check in right away, just hoping that the plane won't be over full and you could get that elusive free upgrade to first class. So I right at 24 hours before my flight, I checked in on the app, and I was like, I'm going to get it this time, and it didn't work. So it didn't check me in. I had a call, and they were like, nope, you're not checked in, and then I was 24th on the list for a flight that had 8 first-class tickets, and I knew for sure that I wasn't going to get that free upgrade that I've never ever gotten before. So they're trying, but it simply isn't working. And when we look around at the technology experiences we have every day, things that are free, like Facebook, somehow are setting the standard for our expectations as consumers on what technology should and could be. But the things that we pay the most for in life, like government, finance, education, and healthcare, have the least advanced technology experiences, in my opinion. The next one, poor customer experiences. Who here loves lining up to board an airplane? No one, obviously. So again, we'll pick on United. And believe me, I like United. I like all the airlines to the point that you could, so I'm not picking on them for any specific reason. But they constantly are redesigning the process of boarding an airplane to make it more humane, so we can jam all of our luggage in the overhead compartments and get on with our day and our travels. It is clear when you're waiting in those lines that most people don't have smiles on their face and aren't excited to be a part of that brand experience. And this is actually a really interesting one. So about 2 years ago, we saw the horrific incident in which United overbooked a flight, and they had to forcibly drag people off of the plane against their will. And this was spread all over social media like wildfire, seemingly overnight, and United was completely eviscerated in the public domain for the practices that they had. So brands ought to pay attention to the consumer experiences that are out there, and if they don't, the rest of the world will. So lastly, increased regulation. This is a shot, I believe, from the Chicago airport, where you see people lining up to go through the TSA checkpoints. I don't know about you, but that's yet another example of how dehumanized air travel has been to go through the cattle chutes of TSA. We know security is important, but wouldn't it be nice if we were a little more thoughtful about that particular part of the experience? So, do we just acquiesce? No. People who are innovators recognize that these variables exist and see them as opportunity to do something different. So along the way, someone invented NetJets. So for the people with money, they could buy fractional ownership or memberships to be able to fly privately, which in all accounts is a much better experience. And at the other end of the spectrum, recently, when you search for a flight on Kayak, which is a normal, everyday way to look for a flight, you now have the option for private flight. This isn't as luxurious as NetJets might be, but the value proposition is you can skip all that other terrible stuff I just showed you. And then finally, there are secondary innovators, people inventing things like the Hyperloop. The Hyperloop is basically an enclosed maglev train that can travel at ultra high speeds. It's being prototyped right now for human travel. That's probably a little bit of ways off, but we saw in India, they just signed their first contract for implementation of kind of a transnational Hyperloop for cargo delivery. So wouldn't it be incredible if we lived in a world where you could go from LA to San Francisco in 35 minutes? If that technology exists and comes to market sometime soon, what will it do to the airline industry? So the proposition is there could be big players that totally irrevocably change an industry because they haven't paid attention to these indicators of disruption. Okay, so now let's talk about these same variables in application to healthcare. Last year, there were 115 large-scale reported healthcare mergers in the industry. 10 of those were considered mega mergers, where both of the parties at the table were worth about $10 billion. So M&A activity is alive and well in the healthcare industry. We feel it right here in our own market, as we know. In 2007, this guy was still president. This is when the first iPhone was introduced. So in the past 11 and a half years, look at the advancements that have been made in mobile technology. It's truly mind-blowing if you travel back in time and think about the first phone. Not only that, but mobile technology in general has accelerated the pace of change in nearly every single industry. If you think about the way that you used to book an airline ticket or the way you used to do business prior to the introduction of the iPhone, a handful of us might have had Palm Pilots, but the way we do business even today is totally changed, let alone the fact that the way that we communicate with our friends and family and stay in touch with each other looks completely differently. Apple's taking it a step further along with most of their competitors by investing heavily in the healthcare space. So now they're piloting and doing clinical trials of their kind of home ECG capabilities to monitor heart rhythms. And if we look at the kind of tech industry in general, we can see the massive amount of investment that they're making. And it used to be that technology was an ancillary competency for business. This was true in healthcare, where your IT department was a supportive endeavor. Today, technology is a lead competency. It is a catalyst for change in strategy in business. And those that don't recognize that are at a disadvantage. Let's talk about the customer experience.
Thank you for calling Look Unique. How may I help you?
It's my wedding anniversary in 2 weeks, and I'd like to make a reservation for dinner.
Did you say 2 weeks? I'm afraid the only possibility would be in 6 months and 2 weeks.
Well, my wife really wants to eat at a 5-star restaurant, so I guess we'll take that. 8 o'clock.
It doesn't work that way, sir. You call us the night before, and we'll let you know when you can come in. Our chef decides who he wants to serve when. C'est bien?
I guess so.
Bah, très bien, monsieur. See you then. It will be your privilege to dine with us.
Welcome to Look Unique.
Thank you.
I have a few questions for you. Are you allergic to peanuts?
No.
Nope.
Or to shellfish?
No.
Have you had any past reactions to bottled water?
No.
Okay, very good. Janice will see you in the next room.
Are either one of you allergic to peanuts or shellfish? Louis here will take you to your table.
Welcome to La Clinique. Thank you. We're a model restaurant. I'm sure you know it's your privilege to dine with us.
Good evening. I understand that tonight is a very special event.
Yes.
Happy anniversary.
Thank you.
All right, so that goes on for about 15 minutes. If it's not painfully obvious, this was about a parody of what if restaurants ran like hospitals. But it brings up a couple really good points that we expect the experience to be different than it is. And it's really, we can laugh about it, but when you experience that as a patient, it becomes obvious that there's room for improvement. Another significant factor is regulation, and healthcare is no different, and for good reason. The gravity of the domain is really, really important. We're dealing with people's lives, and that cannot be lost. So when I talk about change in healthcare and consumerism and all these concepts, it is not at the expense of the importance of medical advancement and the gravity of the care that we receive as individuals. It's just simply that we ought to deserve both. And so if you look at regulation, one of the things that has occurred because of it has been an interesting shift in risk distribution. So this is probably the most, deepest into healthcare that I'm going to get today. So I'll save you the really intense economic concepts and just keep it at this. But if you look at this diagram, the lighter blue represents insurance companies. And if you look at the white, that represents the hospital. And if you look at the yellow, that represents the customer themselves. And this is a diagram that's intended to kind of give you an idea of the proportionality of financial risk that each of these entities or people carry in a healthcare transaction. So it used to be that insurance bore most of the risk. Insurance was, in fact, insurance at the time and not just some type of cost spreading mechanism. And that customers had small deductibles and they had co-pays and some had co-insurance, but you carried a little bit of financial responsibility for the care that you received. And the provider systems had very little. They charged what they charged and they expected to be paid what they got in their contracted rates. And that's it. But regulation has changed that. Risk has been redistributed. So when pressure is applied to this, I always view it as kind of like a balloon with balloons inside. And unless you pop a balloon, everything's just going to try and find equilibrium when you apply pressure to it. So things move around within that kind of the volume of that space. And today, this is what it kind of looks like, where insurance companies have been able to offset their own risk by pushing it down onto their customers who are patients and the provider systems that they partner with. So this isn't a byproduct of regulatory change. And in this case, what we see is that we have customers who have higher deductibles, they pay more out of pocket, have more financial responsibility for the care that they receive. And provider systems now are changing their business models to go at risk for the dollars that they get. This is happening now in our community. With the Medicare population, there's something called the Medicare Shared Savings Program, where hospitals are incentivized to keep people well, and if they don't, they're paid less money for it. So they're at risk for the compensation that they get. This is an incredibly difficult environment to do business in, particularly when the industry as a whole has not been architected to do business in this way. So we see a great deal of change being driven from regulatory. So I want to tell you a little bit about what we're doing about all of this. And again, we view this as opportunity, that all of these factors in between them are pathways to bring change about in the industry. So we're looking at healthcare through a totally different lens. Prior to starting this company, we worked in the design and technology space. We spent a lot of time in Silicon Valley. And when we were there, we really saw the power of design and technology to change other industries. We were working in that environment at the same time that Uber was invented. And so we could see whole industries topple because of some people's willingness to not accept the status quo. So we're applying that same type of design and technology perspective to the work that we do. I'll give you a couple quick hits of the stuff that we're up to. On the consultancy side, we're trying to apply that design perspective to help organizations be more competitive, to take advantage of this change. We have the venture side. I have to put this up here. It's a registered U.S. security. If you'd like this fine print, let me know. I'm happy to send you a copy. So in the consultancy, we're doing things like creating retail physical therapy offerings that are modeled after Nike and Chipotle. We're studying patients in their spaces. So how do you learn more about somebody that can't speak? You spend time with them. You learn what their human condition is like. What's the impact of family and friends in the delivery of their care, even when they're in the hospital? We take a design approach to dissecting and understanding all of this information that we learn in order to present back meaningful recommendations to our customers. We're inventing physical products that are changing the way that people are cared for at home. This is called CareCube, a really cool innovation from our team. And creating applications, this is in partnership with Johns Hopkins to help better prescribe antidepressants in response to the fact that we have a woefully low number of behavioral health providers in our communities. We spend a lot of time taking our kind of voice for advocacy in this space to places like this is Carnegie Mellon. They have a great master's program. It's called the Integrated Innovation Institute. It's a collaboration cohort of business, design, and engineering students. They're some of the brightest people we've ever met, and we go there and convince those brilliant people to recognize these signs of disruption and to do something about it in healthcare. We also like to cherry pick them. And so what you see in a lot of the pictures that represent our work is that we're bringing an experience to our customers that feels a lot more like Silicon Valley than Boston Consulting, but we're working on the same types of really difficult problems and opportunities that major national consultancies are doing, and we're doing it right here in York. So So that's the consultancy. Along the way, we saw opportunity for the venture side. Our venture fund is intended to invest in early stage intellectual property that's invented at colleges and universities, like Martin described in my introduction. We invest in that technology and advance it to a clinically viable stage where it's validated at its invented university. And we sell it at that stage as kind of outsourced R&D to other health tech companies. So it's a bit of a different domain. We really work in the space prior to anything becoming a company, prior to commercialization. So we're really close to kind of the kernel of invention. And we're exposed to some incredible ideas that are coming out of our colleges and universities. I'm excited to announce today, too, as the kind of final component of our presentation, that we're going to continue to grow in York. We're committed to being headquartered in York for the duration, as long as our company exists. We recently purchased 29 and 31 West Market Street, which is the old Market Street Saloon. While we're not going to be a nightclub there anymore, I think it's just as fun. So this is the building. Right to our right is Fig and Barrel, the new restaurant. Our building extends past that and forms the western wall of Cherry Lane Park, right behind the Central Market House. This is a quick shot of what the building will look like as our new innovation studio. And we're really excited to continue investing in our community. The last thing I want to kind of leave you with is that I hope you understand the opportunity that exists in healthcare, that you should move beyond lamenting the change that's occurring and become active in looking at it as an opportunity. Then lastly, we're proof positive that this type of work can be done anywhere. We chose York because this is where we're from. We're from central Pennsylvania. We've recruited brilliant people from all over the country to come work here, and they love being here. And the continued redevelopment of our downtown requires people like me and those in this room to kind of put our money where our mouth is and invest in our community. And in doing that, it's proof that we can continue to make York an incredible place to live and to do business. So, thanks, everybody. Questions? Yes, sir.
How many employees do you have, and how many are here, and how many are?
We have 13 all here.
13 all here.
And we're 3 years old.
From a bandwidth point of view, how many projects do you have going at one time, and how long do they tend to run?
Sure, it's a great question. At any given time, we typically have 6 active clients. Some of those relationships are bigger than others. Right now, I think we have about 38 projects, many of which are being done right here in our local community. It's a lot, and it's important that we continue to find smart people to join our team.
You mentioned that you're working with universities and schools. Can you name a few?
Sure. So in the context of the fund, we have access to intellectual property developed at about 20 universities right now. That includes Johns Hopkins, Penn State, University of Pittsburgh, Carnegie Mellon, as local institutions. We have agreements with people as far west as Case Western right now. We've talked with universities in Chicago, Boston, etc. There's something really interesting happening in colleges and universities, which is that they all want to create entrepreneurial ecosystems. The revenue generated from the sale of intellectual property is significant. This works as a really well-oiled machine with things like drug discovery, and in some cases, the creation of medical devices. But at least in the health world, the kind of health tech space is way less mature. So the volume of ideas available in colleges and universities is massive, but it's not really being fully utilized by kind of the mature health tech industry in the same way that drug discovery happens. Yes?
How many current employees have clinical experience, and what is your need in your firm to have?
Sure. 0 have clinical experience. And we've done that on purpose. So our partners are the experts in the clinical domain. We're experts in design and business transformation through design. And our staff have a diverse background. It's more important for us to find people that have the aptitude to think the way that we think. We don't care if they went to school for innovation necessarily. So we have folks who come from journalism backgrounds, from visual design backgrounds. We've got people who spent time in the nonprofit sector working on a global scale. And so we're more interested in people that bring some type of intellectual power to the table to look at problems through a new lens. And then we just simply partner with our organizations to complement that. However, when you work in healthcare, you very quickly start to build a lexicon of acronyms and topics and things that you have to learn in order to be effective in that particular industry.
In April, the Latino Connection, a magazine based out of Harrisburg, will be hosting the Latino Health Summit here in York.
Okay.
So it's the second annual. The first one was held in Lancaster last year, and we begged and pleaded for it, and they gave us the opportunity to host it. We'll be unveiling that, rolling it out on Tuesday at breakfast at the Appel Center. We'd love to invite you to the breakfast.
Oh, thank you.
And or somebody from your company if they're not available. But I think this would be a great opportunity to engage the Latino community during the breakfast and possibly at the health summit that we're hosting.
Great, thanks so much. Anybody else? Thanks, everybody.